So please, Ed, would you add something on HDClarity, which has already been mentioned?
Thank you, Jean-Marc, and hello, everyone. I'm very pleased to be here. I wish I was somewhere else, but here in London is a fine place to join you from. And I miss you all very much, and I hope that we can meet in person soon. I'm really grateful to the organisers for letting me give you a specific update on HDClarity, because it's a study that's been running for 4 years now on the Enroll HD platform. It's come a long way. We've got a long way to go. Exciting things are happening, and I'm hoping that with your help, we can really boost the momentum as we hopefully emerge from the COVID-19 pandemic together. So you'll probably have seen this slide during some of the breaks, which they've kindly let me display. HDClarity is a study that aims to generate essentially the biggest collection of cerebrospinal fluid and matched blood and clinical data that has ever been collected in Huntington's disease, and to use that with the data from the Enroll HD platform to empower Huntington's disease research, specifically biomarker research, and with a particular emphasis on supporting the development of new treatments for Huntington's disease, in which it's already had a significant hand. And in fact, to that extent, HDClarity has already proved itself to be successful, because it already is the biggest sample of CSF, the biggest collection of CSF samples that's ever been amassed in Huntington's disease. So, in overview, the HDClarity study is an observational study. It's open to anyone who's in Enroll HD, and you can join Enroll HD in order to take part in HDClarity. It consists of some simple examinations, medical history, a lumbar puncture, and venipuncture, along with all of the data that's normally collected with an Enroll HD visit. The sampling and screening visits can happen back to back or up to a month apart. 20 mils of CSF is collected by lumbar puncture. This is a procedure which was very unfamiliar to many people when we started doing HDClarity, but thanks to the trials that have been happening, is much more familiar now, and seems set to be a feature of clinical trials for the foreseeable future. And then participants can be invited back for a repeat sampling visit 6 weeks to 8 weeks later, and then can be re-consented a year later, so as to start building a longitudinal sample collection, and we have plenty of those already in the bank. This is where we are so far. As you can see, over the past 4 years, things have been going really well. 25 clinical sites in 7 countries: USA, Canada, Germany, Italy, Poland, Spain, and the UK. Over 600 sampling visits, amassing over 11 litres of CSF, which is an awful lot of CSF. It's not quite enough to have a bath in. Not that that's what I want to do, but it'd be nice to know that that were possible should the situation arise. The CSF is, of course, put to important scientific uses. The Enroll HD Scientific Review Committee decides on the distribution of samples and data. So far, we've approved 15 different projects, 11 in North America, 4 in Europe. The process is on the left of the screen. Essentially, if you go to hdclarity.net, that will talk you through the process, and any qualified investigator can apply to use samples as long as they're aligned with the purposes of the study. We've had a wide variety of industry and academic projects, from biomarker discovery to assay development to large-scale biomarker validation. And these are already hugely empowering clinical research in Huntington's disease. So what's next? Well, so clearly, it's been a tough couple of years. In the 3 months June to August last year, we collected 12 CSF samples in HDClarity, which was impressive considering almost all of our sites were fully shut down for observational research at one time or another. In the same 3-month period of this year, we collected 31 samples. So the momentum is clearly rebuilding. We're having a huge push on recruiting new sites, including Norway, Australia, Switzerland. One thing I've learned about working with Switzerland, the flag is a big plus. We're rolling out a new amendment to HDClarity, increasing the target to 2,500 participants. We're going to drop the minimum age for adults to 18. We're also, in an ethics amendment that was submitted in the UK yesterday, going to start offering juvenile HD participants down to age 11 the chance to participate if they wish to. We're also making it more of an open-ended prospective longitudinal study. And we're also introducing innovations like the smaller 24-gauge needles that many people are now familiar with through the intrathecal studies, which give a better safety profile. So those are the updates. My call to arms is this: if you're a participant at a site that doesn't have HDClarity yet, please ask your site staff about whether they might be able to get it up and running. If they have it, please volunteer. And if you're a site PI who is running Clarity and needs assistance, or would like to be an HDClarity site, please get in touch. We're all ears. You can find us on the web. You can follow us on Twitter. Thank you for your attention.
Thank you, Ed.